Hi, everybody. Thanks for joining us tonight. I'm Dr. Marnie Fisher.
Yeah, and I'm Dr. Elena Poulos.
We're so thrilled to be sharing the evening with you to talk about what we're really passionate about, lasers and aesthetic medicine, and just the journey of fabulous looking skin.
Great. Amazing. So why are we here? So a few months ago, as we were sitting down with our team and we were thinking about the year coming up and what can we do in-house as a webinar to support our patients and their friends, and really we're always here to serve our community. We thought, well, what better topic to do than really talk about lasers? There is so much out there right now. We know that, in fact, there's over 1,000 laser devices that has actually been approved by the FDA and Health Canada. And that creates a lot of noise and a lot of confusion. So tonight we're hoping to share, Marnie and I, the way we think about lasers, so the science behind the lasers, how we evaluate the lasers, how we think about lasers when we're making choices and helping people in choosing different laser devices to treat their skin conditions. So we're really here to explain a little bit of the science. We're hoping to demystify a little bit. The other thing that we encounter is there's a lot of marketing hype. And so we're here hopefully to help distinguish between what's marketing hype and just amazing companies that are out there flooding the market with marketing messages versus what really is true hype. So what are the real scientific changes and advancements that are actually going to benefit our patients? So we're hoping to go through all this tonight.
Okay, so starting off, let's back up to when lasers were first invented. So they've been out there a long time, and there really is a lot of science behind it. So the ruby laser is basically what it sounds like. There was a gentleman, and he collected some energy, and he fed it through a ruby, like a real elemental crystal quartz, and then he captured the energy in through a little tube, and then it was emitted out the other side, and it was a single wavelength of light. The original lasers were used in medical procedures and surgeries, and then because they are so applicable to skin, quickly moved on to skin and aesthetics. Really, at the beginning, it was tattoo removal and skin resurfacing because they would just kind of ablate away the skin in its early form. And then with technologies and a lot of interest in these energy devices, we have the current day breadth and suite of aesthetic lasers today.
So most of the lasers, as we understand them now, really kind of started taking off in the 90s and in the 2000s. And Marnie and I actually, at the time, we were med students and then residents. So we've kind of been around right from the beginning, which has been actually a fascinating journey.
And we both worked with the game changers in the industry too.
We sure did. So for us, it's really a labor of love, and we've enjoyed it. So in the 90s, it was a big revolutionary decade for aesthetic lasers. And that's really when changes started taking place where the first non-ablative lasers took place. So before then, the lasers were really there. They would really work by sort of burning the skin. So you may or may not have seen photographs of people that really, it's like, the face off laser, where really you were stripping away the whole skin. So that's the time that the first non-ablative lasers came out. And since then, it's been a very fast and furious ongoing change with innovation.
Okay, so just to introduce a little bit of the science behind lasers and light. Really what happens is there is amplification of the electrons that is coordinated with the medium, and the original source is electricity. And then the electrons that come out are then in little photons or packets of energy. And the energy corresponds to either a visible light or a non-visible light, which is beyond the visible spectrum. And then that nanometer or wavelength of light also then is associated with an energy. And then inside of the laser device, we also have the ability to control the tiny packet or the time element that it's on. So at the very, very beginning, when Elena was referring to the not so good outcomes and patients would maybe get a risk of being burned, the packets of energy were too long. And they've been shortened down and they've been controlled in a very scientific manner. And so they've become more and more safe and more specific. The mechanism of action is called the selective photothermolysis, which means that in the non-ablative lasers, we have our little packets of energy of light, and they have wavelengths, and therefore they go a little deep, and then they hit a color or a chromophore, and then that light energy is transferred. And that's basically how we're using these lights with all of these characteristics.
And so this is a diagrammatic scheme here of really how we think about lasers and light. And it really helps guide us when we're making choices with patients. What we're seeing here is an image of the skin under the microscope. So this top layer here is the epidermis. So this is the stratum corneum. That's the part of the skin where the dense skin sort of flakes off. So that's the stratum corneum. And this portion here is the epidermis with the live keratinocytes. Underneath here is our dermal layer. And that's where all the sort of the live structures are. So we have our blood vessels, so the arterioles and the venules. We have our hair follicles that come out. And then this matrix in between that you can see, this light purple color, is, imagine it's like a jelly-like matrix that supports all of those tissues. And that's where the collagen bundles are and the elastin bundles that you hear so much of. So when skin is healthy and glowy and looks great, and often when we're young and we try to hold on to that as we get older, all of these structures are behaving and acting normally. So the epidermis will have normal pigmentation, meaning it's an even pigment everywhere. The blood vessels are normal in size, so they don't look dilated or red on the skin. The hair follicles, sometimes we want them, but not always. And then the collagen bundles underneath, and that's what allows the skin to have a very smooth and even texture. So a soft texture, a smooth texture. And when those collagen bundles are healthy, the pores are very small and invisible looking. So when all of those parts of the skin are functioning properly, our skin looks smooth, healthy. We don't see blemishes like pigmentations or blood vessels. So the lasers are basically targeting these underlying structures. So we think about how deep is our target. So we measure that in terms of millimeters from the surface down. And then the depth will really vary according to what part of the body we're working on. So if we're talking about an eyelid, the skin is less than a millimeter in depth, whereas the thick skin, for example, on our back can be more like 6 or 7 millimeters. And then that depth varies according to where on the face, neck, chest, etc. we're treating. And then across the top are different types of lasers with all different energy lengths. So for example, we have an erbium laser here. The wavelength is 2940. So that's the wavelength of light that's emitted. And we know that this erbium laser, basically the target is water. So when we're treating patients, we know how deep exactly that laser is going. We know what the target is so that we can select appropriately for our patients. And then here are all the various wavelengths of light. So for example, a pulse dye laser over here is 585 and KTP is 532. And we know that both of those wavelengths are preferentially absorbed by the chromophore red, so a red color. So it targets redness and broken blood vessels. For example, the diode laser here is a wavelength that's very effectively targeted by pigment. So it's one that we favor when we're doing things like hair removal. Okay.
Okay, so to make everything a little bit more complicated, it's not even just lasers anymore. So there's lasers, there's light, and there's different forms of energy then, like radio frequency and even ultrasound that is used for aesthetic medicine and improvement of skin quality. So broadly speaking, then, we're referring to all of these together as energy-based devices. So an example of a light device, we have 3 at the clinic, is an IPL laser. We have a Palomar. Some of the original IPL devices were out in 1995 to 2000, and they coined the phrases photorejuvenation, photofacial, and phototherapy. But now it is like the word Kleenex, it's just broadly used everywhere. We also have a broadband light, which we refer to as the BBL. So sometimes when you're in the clinic, you might get the IPL or the BBL. And now we've even introduced the BBL Hero, which is a second gen, which has a gliding mode. So it's really fantastic. It works lightning fast and it's good for body. We are so excited to share this with you November 1st. Example of lasers that we have here at the clinic, single or multi-wave. We do not have a CO2 laser. It's a little bit old school. They're still around. We have an erbium laser for our resurfacing device. We love it. That the erbium is found in our Cyton Jewel platform, which is the Halo as well as the new Moxie. So a lot of you have taken advantage of our new Moxie, which is fabulous for resurfacing as well. And then just a few other examples, the Alexandrite and the diode, as Elena was referring to. The Alexandrite is the medium, produces a 755 nanometer, the diode, the 810, and together with, in our Triton, the 1064, it's a combined laser hair removal system, which we're really, really excited about. Our radio frequency microneedling device that we have offered, we feel is better than the Morpheus, but we feel it is safer and it is more customizable. So again, as Elena referred to, the eyelid skin is 1 millimeter deep. And if the Morpheus starts at 1 millimeter and goes up to 4 and doesn't incrementally go in 1/10 of a millimeter, you can't do eyelids with it. So it is very customizable and we really love our radio frequency microneedling device. Don't forget the P90. Oh yeah. And our P90 for vaginal rejuvenation. Yes, with 2 sensors one sensor is to maintain contact at all times, and the other sensor is a temperature sensor to maximize the treatment outcomes. And of course, our all therapy for laser tightening. So at the very, very bottom of that dermis layer, the attachment of the connective tissue layer to the subcutaneous fat is an all important layer that we hit with the Ulthera to get that tightening and lifting.
Amazing. And to add to it, right? So in addition to all of the various wavelengths, all of the different types of energies that are used in these devices, there are other variations and other innovations. So for example, multi-wave. So some of the devices now will allow from the same box and the same device, different wavelengths to come in. So that allows us in a single setting with a patient that we can actually use different wavelengths during the same treatment, which really gives us a huge flexibility and ability to target issues effectively. For example, another innovation is the addition to dynamic cooling. So several of our lasers, for example, the XLB, One of the reasons that we chose the XLB for treating vascular lesions, which means broken blood vessels, is that it's really the only one in the entire class of lasers that has a crystal tip on it, which has constant cooling. And so when you're able to have that contact with the crystal that cools, it increases the safety enormously and also makes the treatment far more comfortable. Another thing that some of our devices offer is what we call real-time skin monitoring. So when we do the settings on the device, we know exactly how much energy we're putting into the skin. But of course, everybody's skin will respond a little bit differently, depending on the color of the skin, depending on the depth of the skin. And so some of our devices are actually doing a real-time feedback so that we know exactly what the temperature is and how much energy is radiating back out of the skin. Again, it helps us with our settings to optimize the treatments, give best results while still being very, very safe. Fractional technology is another one. So as opposed to the old school lasers that would treat an entire field completely, some of the newer lasers are fractionated, which means the energy is delivered in teeny little columns. So it allows you still to get deep in the skin and get the outcomes you want while making it way easier with less downtime. And then one of our favorite things to do is treatment combinations. And so we do more and more of that, which is really the stack treatment. So within the same setting, we can do 2 or 3 different lasers all at the same time so that there's only less time for you in the clinic, although we do love to see you. So less time, fewer treatments with getting even better outcomes. It's kind of like doing a full cross training at the gym.
Okay, so that's just a little bit about the science, the safety, our passion, our history with our knowledge base and where we're today with our devices that we've chosen for you. So how do you know what to choose for your concerns? I mean, maybe you have some rosacea, some veins, and some texture, but maybe not some pigmentation, or wrinkles and some damage, but not any scarring. Really, the best thing is to come in for a consultation and the discussion to get comfortable with downtime, and then looking at that texture. There can be overlap. There is no doubt about it. And when you look online, you can see, recommendations for this is a top choice for here, this is a top choice there. But really, our devices we have chosen really for you, our patients and our clients. And the packages that we put together will be from our suite of devices for you.
Right. So we just had to include this slide in here because I feel like our team here at Kingsway, I think about it like the Red Bull of Formula One. And this is kind of our team in the cockpit trying to figure it out. And the success, hopefully, of what we do is not so much about what any one individual. So it's not about the individual machine. It's not about the individual technician or physician who's doing the settings, but it's really how we all work together in a team. Dr. Fisher and I, our clinic is still privately owned, and we invest very heavily in our devices, make sure that they're always up to date, and make sure that, let's say, the car itself is really always best in class. But we know that our team around, we always have advanced training. We work together. We constantly work on protocols, and then we redo our protocols and do them again until we're really satisfied that they're really best in class. And finally, when something goes wrong, if anybody has ever watched Formula One, there may be something that goes wrong. It's how fast is your team at really solving that issue. And part of our comfort here as dermatologists is that we know that if there's ever anything unexpected, so somebody may have more swelling than predicted from the treatment, or maybe there's a bruise, or who knows, maybe there's an infection with a cold sore, that we know we can intervene to really be as safe and effective as possible.
Okay, just a couple of befores and afters. If you've never been to the clinic to see these, they really are sort of a highlight of a typical case. The first one represents resurfacing. So I think this was a case of 100%, so full resurfacing. So you can see obviously there is a tightening effect. There is a improvement in the fine lines. There's actually an improvement of the deeper lines and clearance of the pigments as well. In the middle example, before and after, there is some treatments for acne and acne scarring. Acne scarring can be texture, it can be post-inflammatory hyperpigmentation, and it can also be residual redness. So we are game changers in the fact that we do offer a lot of energy-based devices for our patients while they were still taking their medications, both topical and or oral or light-based active acne treatments. So it can really hurry up the improvement of the skin texture and get people that confidence to move on their way in their careers and in their lives. And the last example is basically just everything. You might be in that category where you're like, oh, I have laxity, I have skin wrinkles, I'm feeling kind of lackluster in my skin quality. There's a little bit of reds, a little bit of browns. So you know what, we treat all of that as well. And that would be an example of the combination treatments that we offer. Yeah.
And these examples, so the top patient here, her main concern was a lot of laxity, and you can see her result was really quite amazing and helped her just feel really like, you know, the way she should be and the way she felt that she should be. The patient in the bottom was somebody who has a lot of rosacea with a lot of broken blood vessels. Anytime there was a little bit of heat in the room or a small glass of wine, the patient would flush and get really red and just really not feel like the best version of themselves. So very, very treatable.
Here we have a couple examples of some successes with scar treatments. We are targeting both the texture of the scar. The first example was a keloid scar after surgery. So the keloid was treated with some injectable Kenalog, and then it was treated optimally with the lasers to improve the texture, and then with the vascular lasers to treat the redness as well. We treat scars very seriously here, both acne and traumatic scars and surgical scars as well. And the best results are often seen when you come in almost immediately, within 2 to 4 to 6 weeks. So don't be shy to spread the word out there to people that you know in that category. Another quite typical example of what we treat and the results that we get, clearing red blood vessels and a little bit of dyschromia from sunshine and just wear and tear and sunshine. And then the textural changes in the last slide represent stretch marks. So again, really targeting that collagen improvement and rejuvenation there.
Amazing. So of course, what's next? And we encourage everybody, we've touched on it a few times, but please do come in for a proper consultation. So we have what we call the True You Consult, which is really, we're trying to help you, our patient, feel like the best version of yourself. So we'll walk you through what your lifestyle is, what your goals are, explain all the possibilities, really try to educate, and then help you plot out that journey to get you to where you want to be. And for those of us who haven't already, please follow us on Instagram, check out our website. We've got amazing information on there, lots of before and afters, lots of details talking about what we hit on very superficially here tonight. But if you have time to go in and dive in, hopefully you'll enjoy some of the content in there.
Our social media is really just to educate and really inform you. It's very real. So, yeah. Yes.
Great. And thanks everybody for joining us. Enjoy the rest of your night.